Good afternoon, everyone. Welcome to Public Health Dayton and Montgomery County. My name is Jeff Cooper, Health Commissioner here at Public Health. Thank you to everyone for being here today. We have a variety of presenters today. We're very fortunate that they are here with us to share information with our community. We have Mayor Nan Whaley from the City of Dayton. We have, and I apologize for the order here, it's changed a little bit. We have Dr. Kent Harshbarger, Montgomery County Coroner. We have Dr. Kevin Sherritt, Medical Director, Greene County Public Health. We have Melissa Howe, Health Commissioner, Greene County Public Health. We have Representative Rick Perales from Greene County area. We also have Sarah Hackenbrack from the Greater Dayton Area Hospital Association. And at the very end, I think we'll have some comments from Public Health's Medical Director, Dr. Michael Doan. So again, thank you everyone for being here today. We're especially pleased to have our partners from Greene County present. As we've shared at past news conferences, we've been doing this type of regional response planning and response for many years. So in conjunction with our health departments, our healthcare and hospital systems, public safety forces, emergency management, as well as our city and county officials, we've been doing this type of work for a long time. So we're very pleased to have our Greene County partners here to present their information. We're going to change this up a little bit. So far at every news conference, we've been reporting out on global, national, state, and local cases and data. But for us to continue to do that, it almost sends a message that this really isn't an urgent situation, because the numbers that are reported, the confirmed cases, are clearly an underrepresentation of what's actually occurring in our community. So obviously we're all aware of the federal and national and global websites that are available to look at the data, as well as the Ohio Department of Health now has a dashboard where they report out the data, confirmed cases, hospitalizations, and deaths for every single county. And we would encourage you to take a look at that Ohio Department of Health dashboard. Clearly, the numbers that we've been reporting for Montgomery County are, quite frankly, a gross underrepresentation of what's actually happening in our community. And for us to continue to just say there are 30 or 40 confirmed cases, that doesn't impart a sense of urgency of what we need to do as a community. So we would encourage you to check the Ohio Department of Health dashboard. So we're doing everything we can as a system of partners to slow the spread of infection of COVID-19 within our county and within our planning region. And we're doing this to make sure that our healthcare systems are able to respond to this projected peak in cases that we expect to see in the coming days and weeks. So obviously, all public health departments within our region continue to identify individuals with COVID-19 illness, and then those individuals are isolated. We then are still continuing to identify contacts of those ill cases and make sure that those individuals self-quarantine at their home. And then obviously the message to every single citizen within the entire West Central region of preparedness in Ohio, as well as the state of Ohio, is if you do not feel well and you have symptoms consistent with COVID-19 illness, such as cough, shortness of breath, difficulty breathing, fever, you need to stay home. And we all understand what that guidance is. I think we also all understand that in the absence of a vaccine or antiviral medications, social distancing is essential. We understand the director of the Ohio Department of Health's order, the stay-at-home order. And it's really interesting when you continue to look at the modeling data. It's very clear the difference that we can expect as a community, a state, and a nation if we do no social distancing versus if we apply the evidence base and the best practice for social distancing. Obviously, one individual who's ill over a 5-day period is going to affect, with no social distancing, about 2.5 other individuals. So then you extend that out over a 30-day period, and it's several hundred individuals that then become ill with COVID-19. If we apply social distancing measures, that ratio drops, and it's one infected person infects about another 1 to 1.25 individuals, and the number over a 30-day time period is much less, 30 or so individuals as opposed to several hundred. So it's vital that we continue these social distancing measures. We've reported recently as well that public health has received a lot of calls on our information line. Some of those are just general information calls. Some of those are asking for additional guidance. Some of those have been employees who are concerned about the safety of their workforce, of where they work, and that whether or not their agency is adhering to the director's stay-at-home orders. So, as we shared with you yesterday, Public Health has then notified those employers that we've received a complaint, and our staff have actually been out in the field today and yesterday visiting all 270 sites. And the reason we're doing that, number one, we want to make sure that the complaints that we have received are valid. Let's not rush to judgment and assume that an organization isn't doing what they should be doing as identified in the order. So we'll add to the validity of those complaints. Then we'll make sure that any additional information that they need, we get to them, we'll provide them the guidance, and we'll move forward as a community. So obviously we have started to receive requests for information, and so we are working with the Montgomery County Prosecutor's Office to make sure that we comply with those requests, and we'll make sure that, that we get that information once it's compiled. So with that, I would like to introduce Mayor Nan Whaley to have some opening comments as well.
Thanks, Commissioner. Well, good afternoon, everyone, and I'll be as brief as possible since we're so pleased to have some of our friends in the region from Greene County here to give updates as well today. First, I didn't get a chance yesterday, and today we had on Facebook earlier today is Mickey Doan with the Doctors In with some really good questions, and want to thank Dr. Doan for doing that, and then also wanted to recognize him yesterday since it was Doctor's Day. I didn't get to do that yesterday, so happy belated Doctor's Day for you, Dr. Doan. Also, wanted to mention a little bit about the stay-at-home order. Today, we have a call every day with mayors across the state, with the governor in the morning, and in that call, the mayor of Columbus pointed out that 70% of the people that are testing positive in the Columbus area are actually young people. And I'm sure that's the case in most places. I think he's just done the math faster on it. And I want to talk a little bit about specifically two young people, or younger, that means younger than me. That's how I define young. I'm 44. On why it's important that you follow this order and how to follow it. So there's been a lot of discussion from the CDC nationally to not to stay, if there's more than 10 people, that gathering is too large, and to keep the 6-foot distance. The challenge is when you go and visit, friends and say, well, I only have a handful of friends and we're playing board games. You keep as Dr. Acton calls it, the Kevin Bacon game going. So everywhere you've gone, because you don't live with those folks, you have doubled and doubled the risk across our community. Now, I know this is very difficult, especially for those that don't have children, aren't very busy with families like other people are as they're managing this. But when you do that and you continue to just go around from house to house, you are not doing your community any favors. So we're asking you and pleading with you to follow the governor's order and only travel for when it is essential. So let me be clear. Essential is not playing a board game with your friends. Essential is not going golfing because you feel like it. Essential is about going to get your basic needs for food and making sure that you go to the doctor if necessary or pick up pharmacy. Those are essential. Caring for an elderly relative is essential. So when you're thinking about this, and I know this is going to get more and more difficult as we are further into this through the month of April with the CDC guidelines, think about what is truly essential for you every day. And when you decide that and make that decision, give yourself a pat on the back for actually staying home, because you're saving lives every single day in our community when you do that. I also want to mention something you can do at home tomorrow. Tomorrow is April 1st. That is Census Day. This day happens whether there's a pandemic going on or not. Every 10 years, we have that day as the essential count for our community. So, you can do the census online. You have got it mailed to you. Celebrate your community tomorrow by staying home and filling out the census form. Also, have gotten lots of discussion and comments about unemployment, so I want to talk a little bit more about the system. If you watched the governor's 2 o'clock press conference, you saw the lieutenant governor talk about what they have done. The system is incredibly slow. In the past 2 weeks, they have covered more people than they normally see for 2 years on that system. So they've bulked that system up. They've hired 100 more people, but it takes time to train those folks to be ready. We're asking people to continue to be patient, to maybe go online at times that aren't during the business day to see if there's less traffic there, and recognize that the state has already said that you do not have to get your unemployment day in with a 7-day window, so you have a little more time. I know this is difficult, especially if you're counting on that unemployment check. I recognize that. I know the state is doing everything they possibly can right now to get that up. Keep in mind what we're trying to do to buy time with our health workers, like with flattening this curve, making it go slower. We didn't do that with unemployment, so it started right away, and they weren't quite prepared for everything that was coming their way. We also had a good conversation this morning with United Way about the updated needs for families and folks that need food, and the food bank is doing amazing work. I really encourage folks that are in need, perhaps the unemployment check isn't coming in fast enough, to call 211. You can find that online for all the resources you need, but it's really easy to do here in this community. Just call 211 and you can get they can put you into the right services. So as we're embarking, I think now like on the 3rd week, right, Commissioner Cooper, I want to commend this community on just what a terrific job they're doing paying attention to this order. I know every day I come in and focus on one place that we may not be doing our best at, but overall this community is doing a terrific job of following the orders and believing in our community by doing the right thing, by making sure that we only take part in essential travel. I want to thank you for that and can ask you to continue to do it for our community, for our state, and for our country, to flatten that curve, to save lives in this community. It is already making a great difference. Thanks, Commissioner.
I'd like to introduce Dr. Kent Harshbarger, Montgomery County Coroner.
Thank you, Commissioner, Mayor. Glad to be here today. Good afternoon. I appreciate the opportunity to be here today. As everyone is aware, yesterday marked the first Montgomery County death as related to COVID-19. And with that came focused media attention as it relates to the coroner's offices and potential deaths. Therefore, I wanted to attend today and say a few words related to our processes and maybe answer a few questions if that is necessary. First of all, as you're aware, coroners are watching the slope of the curve as it relates to cases and developing or adjusting our plans accordingly. The majority of COVID-19 deaths will occur in hospital or alternative care centers, and the coroner's offices do not have jurisdiction. These deaths are handled under the normal current processes. But I encourage community physicians and health systems to assist or facilitate registering for the state of Ohio's electronic death registration system so that community physicians can sign death certificates electronically and quickly, facilitating final disposition and reducing the need for funeral homes to bring a paper copy of that death certificate to the various offices. The forms will be posted and are available at the website for Public Health, DaytonMontgomeryCounty.org. So it's in front of me there to my right, where those forms will be available on the website. If a death occurs outside of the healthcare system, my office is notified, but if the individual is under a physician's care, that individual physician will certify the death. Generally, my office responds and handles sudden, unexpected, or violent deaths. Thus, my office may be involved with COVID-19 cases, knowingly or unknowingly. as we still manage our normal day-to-day workload. We have processes in place to handle COVID-19 cases, systems in place to deal with cases because we still may not know a positive case is under our care. My office will assist with the potential for fatality management should storage issues for the county or region become an issue. Finally, I'd like to add my voice to the continued message that you just heard again today. Stay at home. Wash your hands, and when you must be out, practice physical or social distancing. Our nation's healthcare workers who are on the front line are relying on each and every one of you to take care of yourself, so they or I do not have to. Thank you.
Would like to introduce now Dr. Kevin Sherritt, Medical Director for Greene County Public Health.
I am Dr. Kevin Sherritt. I'm the Medical Director for the Greene County Health Department. I'm also the Greene County Coroner, and just want to take a minute to thank Health Commissioner Cooper and the entire team here at Montgomery County Public Health, as well as Dr. Harshbarger, who we've worked so closely with over the years in working together to fight this pandemic. As been mentioned here, the situation is crucial, and the concern is that we are facing the calm before the storm. As a practicing physician, we get asked questions every day, and the first question we get asked by our patients and people calling is, what can we do? What can we do? And in answering that question, I remember back as a resident in training at St. Elizabeth's Medical Center many years ago. I had a patient that was a world-class ballroom dancer, and I just marveled at the dance that they were able to perform, he and his partner. And I asked him many times about that. And I'll never forget him telling me one day, he said, "Young man, never forget this. The greatest performances are the result of basic steps executed well." As we fight this, and we relate to our patients, we tell them the basic steps, which have been repeated, and I want to repeat them closely here now. Wash your hands. Wash your hands well. Don't go through the paces. Really wash your hands. Avoid any social contact that's not absolutely necessary. If you do not have to go, don't go. If you can go another way, go another way. If you do go out in public, then distance yourself and keep your distance. Again, every contact that you eliminate saves lives, and that cannot be stressed enough. The second question that we get asked frequently is about testing. People want to be tested, and I understand it. And if I had my way and I could do it, we would test everybody because there would be benefits to that. But the reality is, even though we're hearing each and every day, and I'm excited about the prospects of rapid testing and in-office testing, and it is on the horizon, the truth of the matter is it's not here yet. And so there are still real limitations on testing. We are limited in our personal protective equipment, which is required every time we test someone, and we're limited by the tests that we have available. So there are guidelines to testing. You can learn those guidelines, they're published, or you can talk to your primary care provider about the guidelines, and they can share with you the guidelines on testing. I do anticipate that changing very soon, but as of now, we cannot test everybody. We have to save the tests for the most critical among us, and the health department, the health workers among us. For primary care providers and other providers in our community, thank you. You're on the front lines and you're serving well. Our communities are doing a good job. I want to just mirror what Mayor Whaley said, that I have been impressed with the response. People are taking this seriously, and we're urging you to take it seriously and ask you to continue to do so. If you have questions, reach out. Reach out. There's various ways that you can reach out. The provider networks in our community, and we have excellent health care available in our community through our provider networks, have all went to telehealth visits and virtual visits where you can reach out to your provider and interact without going to the office. Now, certainly we're still seeing people in the office. There's situations that we need to see people in the office. I had patients in the office today. But just as I said a minute ago, if you don't have to go to the doctor's office, reach out to them. And there's other ways that you can connect with your healthcare providers. They're there for you, and they're doing a great job. So again, thank you. to everyone from Montgomery County. Thank you for the work that you're all doing, and we are in this together, and ultimately we will be victorious. Thank you.
Thank you, Dr. Sherritt, especially for sharing that information about the ballroom dancer. For the record, there is a public health employee in the room today who is also a skilled and accomplished ballroom dancer. Let the record also show that it's not me. My spouse would say I have the flexibility and rhythm of a fire hydrant, so that's not going to be me. So anyways, thanks for sharing that information. Next, it's my pleasure to represent Melissa Howe, Greene County Health Commissioner, who, in every sense of the word, is a true leader, not just in her county, but in our region and throughout the state of Ohio. So welcome, Melissa.
Thank you, Jeff. It's a pleasure to be here with you today and talk you through what has been going on in Greene County. Just like Montgomery County, we have been mobilizing our community from the beginning when we first saw those cases in Washington, and we knew that this was going to be a big problem. So in Greene County, what we did is we divided up into sectors and made sure that we talked to our physician communities, went to the Greene County Medical Society, and made sure that providers knew that this was coming. In Greene County, I want to report that we currently have 6 cases, 2 hospitalizations, and of those 6 cases, we had 1 death. Our fatality was not healthcare facility related, and it was not related to travel. I think that's important to note. So many people are pointing fingers and looking to lay blame, and I want to address that as I'm speaking today. Our county commissioners shared with me that they were deeply saddened and devastated to learn of the first death in Greene County from this evil virus. They want everyone to take this seriously and practice social distancing. If everyone stays home and does their part, together we can lessen the impact on Greene County. Please protect your friends and your neighbors by limiting exposure. Currently, there's community-wide spread going on, and we are in that acceleration phase, as you've heard. We're using a structure known as Area Command. It is a multi-agency, multi-jurisdiction command structure. At the core of this work, though, our purpose is to ensure the health and safety of individuals, our families, our partners, and our community. And we have pre-established relationships with all of those sectors that I was telling you about. And I know Jeff has spoken previously that public health really is this blanket. The public health system is this blanket of protection. And right now, it is being stretched thin. But we are encouraged by the work that is going on in Greene County. I want to give you an example of that. One would be Josue Solomon of Yellow Springs. He's the village manager. Yellow Springs really came together very quickly, and they have coordinated their volunteers for meal delivery. They've began searching out resources for estate planning, healthcare powers of attorney, and living wills. They're also sharing information on credit counseling and mental health services. We want to stress personal hygiene, too, prior to visiting the parks and the trails in Greene County, particularly Yellow Springs, because we are well known for our parks and our bike trails. Please don't use the trails if you're experiencing any symptoms, and be prepared for limited access to the parks and trails while we try and encourage people to distance, and follow the minimum 6-foot distance from others. Just like Montgomery County, we will continue to focus on our mission and our message. I want to shift gears a little bit because I want you to know that public health workers are also first responders. I know many times people think of them as police, fire, EMS, or healthcare workers. Next week is National Public Health Week, and I want to tell you about the wonderful public health workers who have been working so hard for the last 2.5 months on this, long 12-hour days, trying to stand up communities to make sure that they're ready to the best of their ability. We have registrars that do birth and death certificates, registered nurses doing case investigation and contact tracing. We have registered sanitarians handling the license programs and all of those complaints that you're hearing about. We have home visitors. We have early intervention service coordinators. We have office support and IT professionals that help our electronic tracking systems work. Each day, we plan to set aside a day next week to focus on the impact that COVID-19 has had on mental health, maternal and child health, violence prevention, the food industry, education, and let's not forget Dolly Parton is going to be reading to our children through the Imagination Library, persons experiencing homelessness, and the business community. Our ask from Greene County is for donations for PPE for the first responder community. You can go to our website, www.gcph.info, or you can visit us on Facebook, and you'll find there our requests for donations for PPE to support the efforts of our healthcare facilities and our first responders. And we're making this plea to individuals, to businesses, to our universities, to the tattoo facilities and the salons. We're grateful to the partners that we've made and have donated already, including Lowe's and Caring Partners International and local dentists. We also have a plea from our first responders in Greene County. They are planning for increased calls. They are planning for interfacility transfers and personnel absences due to illness. They'll be asking you screening questions, the COVID-19 screening questions when you call in. You should let the dispatchers know if you are having symptoms that you believe are associated with COVID-19. Call 911 when you need it. However, as Dr. Sherritt referred to, individuals with minor health concerns should be calling their healthcare provider or urgent care. We are trying to avoid delays in those response times too, and we don't want them to have to defer your call. Again, as you heard on the call earlier today, please take time each day to step away from all of this. Step away from the news reports and the latest research discoveries. Stepping away is an act of mercy for yourself and those around you. It will bring peace of mind to your heart and peace to your mind. We all have a choice in the way we respond as individuals and communities. We're coming to these circumstances with different challenges before us. As one Greene County resident told me, the evidence is mounting and no one can deny the seriousness of these infections. We have to set aside our distrust and buckle down at home. Staying home saves lives. We like to say, stay and slay. Stay home, stay apart, slay the virus. Greene County, the Miami Valley, and the state of Ohio will be remembered for our bravery and our resilience.
Thank you, Commissioner Howe. We echo your comments about public health workers being first responders as well. We've all recently learned of a health department, local health department in the northwest part of this state that was closed for a set period of time due to COVID-19 illness, as well as just recently learning about another county health department who recently lost a Board of Health member due to COVID-19 illness. So this virus has the potential to touch all of us and everyone that we care about. All right, next we have Representative Rick Perales from District 73.
Well, thank you, Commissioner Cooper, for this gathering. Mayor Whaley, thank you for bringing everyone together. Commissioner Howe, thank you for inviting me. Dr. Sherritt, as you've already heard, this virus, COVID-19, doesn't see county lines. It doesn't see city lines. This affects us all. And that's why I'm so pleased that we're all here together and Greene County's here sharing with this. I will tell you that I am a veteran. And we have a lot of veterans out there suffering from this, a lot of homeless veterans. I am informed that in Greene County, and I'm sure similar in Montgomery County, there are 4 homeless shelters, and they're all in jeopardy of being closed because we don't have the volunteers. You know, yesterday was Vietnam Veterans Day. Our vets, Vietnam vets that certainly weren't welcome back home after their endeavor, not like other time frames. And many of these homeless vets are Vietnam vets. We need to step up and support them and the other homeless folks there. I am told that if you contact the Greene County Health Department, they can try to match the skills with the needs, and I'm sure Montgomery County will do the same, so that we can keep this resource open to these folks, keep these folks safe, and the people that they contact safe. It's very important. We've got to take care of those that have fought for us. It's that simple. I would like to address one other issue that has been brought up. Mayor Whaley talked about unemployment and employment and your workers. From the state perspective, I will tell you there's a lot of confusion. I would tell you that the Governor DeWine, Lieutenant Governor Houston, they're doing a wonderful job with their staff to get the word out, but it's still difficult. The lines are busy. It's hard to get through. One thing that everyone needs to understand is that we are waiting on how the feds roll everything down to figure out what we can best do to support the employers and employees in the state. But the one difference everyone has to understand between the feds and the state is we have to have a balanced budget. The feds can make money. They can do whatever they want to make it happen. Right now, we have about $2.7 billion in our rainy fund in the state. We're projecting that it's going to take well over $2 million of that to get through this year, just on Medicaid and unemployment. So we have to figure out how we can use the rest of that money to best satisfy what the people of Ohio need. So keep that in mind as you talk to people. And I guess last, what I'd like to leave you with is we work for you folks. We were elected by you folks. We work for you folks. If you have a question, you need to talk to your state senator, your state representative. You need to contact them. You need to tell them what it is. You need to write it down, and you need to get answers from them working up through. Same with your township trustees, with your city mayors and everyone. We work for you folks. We're here for you. You need to use us to make sure you get the accurate information you need to make good decisions and to plan what's going to go on, because yeah, we've moved this out until the end of April, but who knows truly how long this is going to go. We have to be prepared for anything that's out there, and your legislators and your elected officials should be there. They need to be there to support you in this endeavor. So please reach out to them. I know that my colleagues in Columbus, both in the Senate side and the House side, are eager to do whatever we can do to find out what we can do to help you folks. So again, I thank all the people in this room and just the diversity. I think Mayor Whaley and I are the only two elected officials here. Everyone else is health, as it should be. But we're all working together to make this situation better, get through it, and get on the other side. And I'm convinced we're going to be stronger and better once we get on the other side. So thank you all very much.
And next we have Sarah Hackenbrack, President and CEO of the Greater Dayton Area Hospital Association.
Thank you, Commissioner Cooper. Thank you, Mayor Whaley. Thank you to everyone who is here today. Our planning and our collaboration continues with our region's hospitals. As many of you already know, the Greater Dayton Area Hospital Association works with 29 hospitals and health systems in an 11-county region. So the collaboration that we see here today with our partners in Greene County and Montgomery County is very much the nature of how we work together in partnership with our region's hospitals. And really, because of the nature of this crisis, the collaboration and the cooperation, as well as the information sharing and transparency between our member hospitals is unprecedented. And so the internal work to build capacity continues. The external work to build new relationships and partnerships with other non-hospital healthcare providers who may be able to assist us throughout this crisis continues. And our partnership with our emergency preparedness experts, our Ohio EMA, our local and county EMA experts, as well as the Ohio National Guard. Some of those are new relationships that we are building so that we can be prepared for the crisis or contingency capacity that we may need here in the Dayton region. And as this effort continues, we've already talked about the visitor restrictions that our area hospitals have implemented across the region. And so as a reminder, that is no visitation for any of our hospital or healthcare facilities in the Dayton region. And the one change and update that we have had to make to that policy is for our maternity patients who are now limited to one visitor, one support person for that labor and delivery activity. And we understand that that is a challenge, and it is not the ideal situation in the way many women envision celebrating and welcoming that new life into their family and into our own community. But in Ohio, we have now seen younger and younger cases of COVID-19 be diagnosed at the state level. And so we need to be prepared in our region to take care of the most vulnerable citizens who are just joining us. And we need to be responsible and respectful to make sure that we get them from that critical time where they're little infants and get them into the next phase where we can celebrate their first birthday with them a year from now when things will be much better and much different. Thank you.
So we realize that this is going on quite some time, but that's all right. We have a couple comments that our medical director, Michael Doan, would like to make regarding some epidemiology data.
Thank you, Commissioner Cooper. I'm Michael Doan. I'm the medical director for Public Health Dayton Montgomery County. And even though I'm last, I think you want to hear what I'm saying. We've had a lot of discussion that I've heard over the last couple of days. People are talking about different models, and the model shows this, and the model shows that, and they're very complicated, and there are a lot of variables. One of the things is hard to predict, and that is our behavior. The biggest variable in all the models is how we behave, and whether we do really stay at home, whether we limit our gatherings, whether we abide by the recommendations that are out there. There are things that the hospitals have done over the last couple of weeks so that they started out about 75% full with about 25% ability to accept new people and do care. With their efforts to cancel elective surgery and other sorts of things, they are now about 60% full. So they created an extra 15%, okay, more than 50% increase in their capacity, all right? Another thing, of course, is the emergency departments. And this is going to be maybe hard to see. Is that hard to see? Probably. But this will be on our webpage as soon as we get through here and the person standing directly in front of me gets it onto our webpage. But it shows, well, they can't point to it then. Can I point over the edge? All right. I'm going to stretch my arms out. So that this starts out last year, this great big peak here, that's when we were hearing that there were so many influenza cases in the emergency departments that they were full, that they were really stressed at that point. That's the last week of December. So that was just around New Year's. Since then, you can see it kind of came down. We had a little second spike for the influenza, which often happens. We got A influenza, B influenza, and then it kind of continues to drift off. A couple of weeks ago, it started going up again, okay? That was related to COVID. These are specifically visits to emergency departments for fever and an influenza-like illness, which we all know now means a cough and shortness of breath and the rest of that. So that last week dropped off. So the number of visits went down, okay? Even though we know more and more people are getting sick, all right? The other thing that's interesting is this is total emergency room visits. And we can see that, again, we have a peak here at the end of the year related to the flu, but last week, total emergency room visits dropped off a bunch. So what does this tell me? Okay, it tells me that people that are getting sick and feeling like they've got disease, they aren't going into the emergency room. They're doing what we say, which is to stay home. Take care of yourself unless you get so bad that you just can't make it and your symptoms get so bad. It tells me that for things other than those kinds of respiratory symptoms, people are not going to the emergency room. They're trying to avoid that. They're staying home. We're taking care of ourselves as best as we can. This means that not only does the hospital have more bed capacity, but the emergency rooms have much more capacity now than they did. And that also makes me think that you all are doing a good job about staying home, washing your hands, and all the other stuff we talked about. This is just a very real kind of way to measure the fact that as a group, hundreds of us last week made a decision not to go to an emergency room. That's really all I wanted to say. It's just I think it's working, and that all these little actions make a huge difference in what we're going to be able to do and deal with later. Anything else? All right. Do you have closing comments?